Here are a few orthopedic myths that I'd like to debunk for you. Hi, this is Dr. Levi, the gamers and esports doctor. I'm asked this question every week by some patient, and that is the following. Number one, Dr. Levi, if I crack my knuckles, am I going to get arthritis? Let's talk about that. When you're cracking your knuckles, like I'm doing right now, it's clear now that it does not cause any type of arthritic problems to your joints. That is from basically bubbles of gas that are inside your joints, that when you compress your joints, the articulations, when the bones press together, the bubbles of gas basically explode, and that's what we hear. So no, cracking your fingers, cracking your neck, cracking your knees, your elbows, it's clear now that there is no double-blind study that I'm aware of, and if there is, please let me know, that states that if you do these things, it will cause arthritis to those areas. And arthritis, of course, is this esoteric term that simply means there's an injury to the joint, and now you have bone articulating with bone. So let's demystify that one. Another one that I hear very, very often is Dr. Levi, if I run a lot, will I get osteoporosis? So let's talk about that. Running causes compression against your joints. Therefore, running is actually good for overall bone health. However, running does cause now this constant compression of the joints, especially in your feet, your ankles, your knees, your hips, your spine. There is compressive forces that occur there. But does it cause osteoporosis? I don't know any study that says if you run, you're going to develop osteoporosis. So I really want that to be clear. Now, the third one that I hear very often is if their child has an apophysitis, like Osgood-Schlatter's disease, which is basically the patella tendon where it attaches to the tubercle of the tibia, they'll have an apophysitis there. Basically, as they're growing, it's basically not keeping up, so they'll have a tension apophysitis there. So they'll have pain right below their kneecap, right below their patella. And I'll often be asked, well, if they have that, does it mean they're going to have arthritis in their knee? No, it doesn't mean that at all. It just means that they're growing, and eventually this usually it dissipates. So those are three little myths in orthopedics that hopefully I've given you a little bit of knowledge about that can be completely debunked at this time. So if the literature changes, then I'll let you know about that too. All right, this is Dr. Levi. Keep on exercising. There's one that I thought about too, is if I drink coffee, does coffee make my workouts better? So there are some studies that are really quite clear that if you do drink coffee before you work out, because it's such a stimulant, that it can make your workouts stronger or possibly better. But again, I want to reiterate, when it comes to drinking coffee, there's the high, there's the up, and then there's the down. So I just recommend that you eat properly. Don't eat at least an hour to 90 minutes before you work out. Drink water and electrolytes while working out. And I hope that helps you with respect to demystifying this issue about coffee. Does coffee make the workouts better? You know, by some scientific papers, it seems like it does. But I don't know of any other drug or supplement I can talk about like that. You know, one thing side note I'll give you is that I hear the same about creatinine. You know, people tell me they're taking creatinine and they think that this will help them. We don't have any sound scientific knowledge that will really help you overall your workout. You know, we know it does load your kidneys. So I hope that helps you. This is Dr. Levi. I'll talk to you soon. Bye.